What we're seeing, I think, is a glimpse of the future. Whenever I go outside of Greater Manchester, people say to me, we want what you've got. And you can see how we've come on in leaps and bounds.
So devolution has really helped us get in the same room to communicate better, so that we've got public sector workers next to healthcare workers, we've got social care next to nursing, so that they can agree plans together.
People like me, brought up in Greater Manchester, who really care about the area, want to make sure we do the best for the system. So in a sense, it's not anonymous civil servants. It's us working with local people, working with local hospitals and local health systems to provide better services.
Devolution of health and social care in Greater Manchester basically means that decisions about the health and care of our residents and how we provide services that were previously taken in the corridors of Whitehall and in the national offices of NHS England are now taken locally here in Greater Manchester. One key element of devolution is our plans to integrate health and social care services. Our view is it isn't right that it's left to individual patients and their carers to try and join up services. To expect you to have to talk to, could be 10, 12, 15 different agencies to make your care work cannot be the right way to go about things. So what we're doing is saying no, the state should join up those services, and the experience for the individual should be that they're dealing with one person and one organisation.
The main thrust of our work is improving access, so that we have made a lot more appointments available, but to give you more chance, whether you're working in the week or whether you simply can't get the appointment that you'd like, to give you another chance to see a GP. And we'll be bringing as much care out of the hospital as we can possibly do to place it closer to people's homes, so it makes it more accessible, it's more understandable for patients, so they know how they can contact and get the best care. They've been the things that we've really started with, along with standardisation of care, so that if you're in Stockport, you would get the same sort of service in primary care to someone that's in Oldham or Salford.
First of all, we brought together the CCG and the council into one single organisation, one single budget. Amazing things, actually. We don't exist separately anymore. A single approach to mental health, a single approach to learning disabilities. The council runs an active leisure function, a sports trust. We've connected all of that work into our health and social care systems. So this year we've got 2,000 people with long-term conditions who have got exercise on prescription. Quite transformative, really.
We see this as a whole. We see getting people into employment as being part of the health strategy. Getting kids ready for school at the age of 5 so they don't start falling behind immediately they get to school. That's part of the health strategy. So it's for us, it's all tied up in the single objective.
Because the essential thing is with social care is that it has a huge impact on health care anyway, and you can't deal with the two separately. We're trying to stop talking about health and social care, and we talk about care. So I wouldn't be involved if I wasn't really hoping that this could transform services in a way that we've always dreamt of. But it's never been as radical and ambitious as now, and we've never had the opportunities to break some of the rules.
The level of engagement and enthusiasm that you encounter on a daily basis from the people that work in the system, because you've finally given them an opportunity to reshape their future in terms of what they want to do, and they can deliver better outcomes for their patients, for the people they care for, is quite fundamental.